HealthFit started in, I believe, 2015 with my wife, Dr. Kelly, and I. Dr. Kelly's a chiropractor, I'm a physical therapist. And the goal was to create a multidisciplinary office, wellness office, that we could essentially treat our clients, our patients, like they are professional athletes. Working in the past in professional sports and currently working in professional sports, it's all about the betterment of the athlete. So you have the athletic trainer, you have the nutritionist, you have the sports medicine, you have orthopedic doctors, all working together to get the athlete back onto the field or back onto the court as fast and as safe as possible. So we wanted to create a clinic just like HealthFit, where we could utilize multidisciplinary ways to get you back to where you want to get to. And that was the original vision. As time went on, and when we were trying to put this together, we had to figure out, did we want to treat multiple people at the same time, or did we want it more on a one-on-one basis, where we could essentially send our own parents to, our own family to. And before we created HealthFit, we had our own things going on where we were treating one-on-one. And we found that we built better relationships. We were able to get down to the underlying problems a lot faster because we had time to talk, we had time to test. So we got them better faster with less visits. And that's essentially what a professional sports team does, right? It's like all hands on deck to get you back to where you want to be. So we felt when we created HealthFit that we wanted to create a similar model where it is completely one-on-one with your doctor. Instead of using aids or machines, it's just more one-on-one with the doctor, where each session is always an evaluation. Every hands-on treatment is an evaluation. Every exercise that you do is an evaluation with the doctor. So that was the original vision of why we created HealthFit and this model. I think one of the biggest reasons why people pick us here at HealthFit is that we take the time. We take the time to get to know you. We take the time to get to know your problem. Because I think there was a study not too long ago where, let's say you're going to see your orthopedic doctor. I believe the average time you actually spend with your doctor is 5 to 7 minutes max, right? And even in some physical therapy or in chiropractic clinics where there's seeing multiple people in the hour, let's say it's 4 people in the hour, you have 15 minutes max with your physical therapist or chiropractor. Here, you're spending anywhere between 30 minutes to an entire hour every time you're with them. You're not handed off to aides. One, from our side, we get to find out more about your case. Coming from the other side, our clients or our patients get to ask us anything, and they have full accessibility to us. So I think that is a big draw of why people come here to HealthFit. I believe our attention to detail is great. Our responsiveness, whether it's from our front desk staff to our doctors, answering emails as much as possible if you have any concerns and those kinds of things. I like to think that we take the extra mile when it comes to your care, and that's not including us being good at what we do as far as our skill standpoint, as physical therapists, as chiropractors, as fitness professionals. We're very skilled at what we do, but when we layer the other things on top of it, I think it creates a much better experience, which allows you to get better, in a good way. Number one, when we look at our team and we look into hiring someone, number one is you care and you're a good person. Because in a rehab setting, let's say you come in for pain, it's not like we're giving you medication or an injection or anything like that. There's no real instant fixes. So what we try to do, or what our goal to do, is to create a relationship, to partner with you, to figure out the best strategy that you can use at home and here and in conjunction with us, so we can get you out of your pain, number one. Number two is finding the underlying cause of your pain and addressing it further. So what I'm trying to say is that for 10 clients or 10 patients that come in here, each one of them is going to have a different journey. And it's not just about the exercises or the hands-on skills that we give to you. It's about learning your specific situation, how you got there, how your pain is behaving, when it comes about, when it goes away, what makes it better. And to devise a personalized plan for you. Because let's say you're dealing with plantar fasciitis. If I gave you the exact same treatment that I gave to this person, it may or may not work. So I really have to be able to dive in a little bit deeper to figure out, one, are these the right things for you? Number two, how much time do you have to allot to this journey to do these certain exercises, the consistency of it all, and even looking at the day-to-day nuances that you have that may affect the long-term result. So when I say that, when I say it this way, it seems like it's a lot of work, because it is. And some of the offices that you may have, like if you've been to PT or chiro before, is you may be treated as a number. And because we are one-on-one, we only see 7 to 8 people a day. So that attention to detail, learning your story becomes very, very important, because it's just about getting to know you, getting to know your story, getting to know exactly what makes you tick, so we can help you along the way. So like it goes back to, I ramble a lot. So it goes back to that part of picking our team. Number one, that they care. And it doesn't matter whether you're one of our doctors or one of our front desk staff, one of our sales staff, everyone has to be a good person and they care. On top of that is obviously the skill standpoint. Are you good as a physical therapist or a chiropractor? And are you willing to learn, continue to learn to get better at those skills? We frequently get together as a group amongst the professionals, as a entire staff, to assess how like the week goes and to pinpoint things that went well, things that we could have done better. And along those lines as we talk about patient cases. So like if someone is stuck on a certain case, we collaborate, we talk, we figure out other continuing education opportunities for all of us to continue to get better. And it's with that collaboration, it's with that initial great skill set that we can continue to build on top of that. So I would say those are the top two things. Number one, they care, and two, they have great skill. What inspires me to do what I do? I would say it's definitely evolved over time. When I first went to school, when I first became a physical therapist, I wanted to be the best physical therapist, skill-wise, that ever walked this earth. You know, I did so many continuing education courses, I treated a lot of clients, I got better at the skill standpoint. As time goes on, I get married, I have kids, we have a company, we have other therapists, we have other employees. And it really has evolved to being a leader and a mentor to everyone around me, whether they want to get it or not. And I truly feel that the things that I have learned, hopefully the good things I'm able to pass on to even some of our newer clinicians, right? I've been doing it for a long time, and we always say we want to teach people in a good way so they don't make the same mistakes that we made. But the truth of the matter is everyone's always going to make mistakes. And I truly feel that it's how we look at those mistakes and how we move forward from those mistakes is how we get better faster. And when you can relate to someone in a way, like let's say it's one of my doctors and something didn't go right. And I can talk about my experience. Oh, yeah, I experienced that too. And I tried this, I tried that, and this is the one that worked for me. It's not the fact that he or she didn't make a mistake. It's giving them an avenue of maybe this is a better avenue to go. Because I tried these three, maybe this one's a better avenue. and to look at it as mistakes aren't to bring you down. The mistakes are made so you can learn and be better. And I think that is how my perspective has changed over time. I will continue to do what I do when I'm treating clients, but to impart that wisdom, if you want to call it, to the other people around me. And even perspective of, I'm married with Dr. Kelly, we have 2 kids, and kids are gonna make mistakes. You have to allow them to make mistakes at times. You try to create a system that there will be less, but it can't be so micromanaging where you control everything for them. And I really feel that my management style has evolved over time too, where I trust my team. And I trust my team to do the best job possible, but I'm always there if they need me. How do I manage this business, working with the LA Football Club, and the family life? Who knows? It's definitely challenging. It's hard. But I love to do it. It really comes down to time management and prioritization, finding what's going to make the most impact, and what does each part of my life need from me the most. And that just comes with time. You know, as far as the family, having talks with my wife, and when I am home, being present. Sorry if I'm not present sometimes, honey. Being present with the kids, being present with my wife. When I do have free time at home or free time with the family, making the most of that time. Obviously, the club, the soccer club, takes up a lot of my time as well, and I try to be as efficient as possible while I'm there to get the work done that needs to be done. Here at the company, I'm able to balance all 3 is because of the team that we have. And the team, the people, the resolve, the drive. We have an amazing team here at HealthFit, and I wouldn't be able to balance all 3 if we didn't. And I look at it as my goal, my job, like I said, to be a mentor and to have people in place that like to be held accountable and are upfront when they're not reaching expectations and stuff like that. And then really my style is, okay, how can I help you get there? And it takes a special team to be able to do that. Everyone is upfront, wants to be better, works hard, and that is how I manage all 3. I think the stars align when you have good people in place, and I have an amazing wife and kids I can count on, and they do understand when things get busy for me, that they understand both sides. So I'm blessed to have an amazing family and group.